This is important, and it's something you need to know about right now. Starting March 7th, Social Security is making a major internal change that affects how cases are handled, how appointments are scheduled, and how problems get resolved. And I'm not talking about minor adjustments or small procedural updates. This is a fundamental shift in how the entire system operates behind the scenes. If you don't understand how these changes overlap, you could face delays, confusion, or extra frustration when you need help the most. Some updates may improve service, and there are legitimate improvements being made that we need to acknowledge, but others could temporarily slow things down, especially if you're dealing with disability claims, SSI applications, or a complex issue that requires human judgment and local knowledge. Before I go further, let me ask you something real quick. Have you ever had to call Social Security or visit an office for help, even just once? Maybe you had to resolve an overpayment notice. Maybe you needed to update your direct deposit information. Maybe you were trying to get answers about why your disability claim was taking so long. Let me know in the comments. I'm always curious how those experiences line up with what we're hearing from the administration versus what people are actually experiencing out in the real world. Now, so here's what's changing, and I'm going to take my time explaining this because the details matter. For a very long time, we're talking decades here, Social Security worked in a pretty local way. You had your local field office, and that office handled the cases for people in that geographic area. The staff there usually knew the local rules inside and out, understood the state-level programs, and knew exactly how Social Security interacted with things like SSI or state supplements where you live. In a lot of ways, those offices functioned like their own small versions of Social Security. They had autonomy, they had local expertise, they developed relationships with the community. If you walked in, you were dealing with people who handled cases just like yours all the time. The person helping you with your SSI application in California understood California's state supplement rules. The person in Florida knew Florida's specific eligibility requirements. There was something to be said for that model. Yes, it could create inconsistencies between offices. Yes, it meant some offices developed backlogs while others had spare capacity. But it also meant you were getting help from someone who understood the specific context of your situation, not just the federal rules, but the local reality of how those rules played out. Starting March 7th, that model changes significantly. Social Security is moving to a national system for handling work. Instead of your local office mainly handling local cases from the community it serves, offices will start handling cases from all over the country. An office in Maine might be processing applications from Texas. An office in Oregon might be resolving issues for someone in North Carolina. This is being done through two new systems that are being implemented simultaneously. One is a national appointment scheduling system that centralizes how appointments are booked and managed. The other is a national workload system that distributes cases across the country based on capacity rather than geography. The idea behind this, and I want to be fair to the reasoning here, is that work gets spread out more evenly across the entire agency. So if one office is overwhelmed with a 3-month backlog and another office has capacity with staff who have availability, cases can move around instead of sitting in that backlog waiting for the local office to catch up. On paper, that might sound reasonable. It might even sound smart. And to be fair, Social Security says this is meant to reduce backlogs and make better use of staff time across the entire organization. They're saying local offices will still exist. You can still walk into your local Social Security office in person, and those offices will still be the front line for the public, the face of the agency that people interact with. But behind the scenes, the actual processing of work is becoming much more centralized. The person reviewing your application might be in an office 2,000 miles away. The person scheduling your appointment might have never heard of your city. The person trying to resolve your overpayment issue might not understand why your state has different rules than other states. And this is where things get a little complicated and honestly a little concerning for some people, because this change isn't happening in a vacuum. It's happening against a backdrop of major upheaval at Social Security. Over the past year, the Social Security Administration has gone through a lot of changes, and not all of them have been smooth. About 12% of its workforce is gone. We're talking roughly 7,000 jobs eliminated. Some regional offices have closed their doors permanently. Leadership has changed at multiple levels. Phone systems were completely overhauled, which caused confusion during the transition period. And at the same time, beneficiaries are being encouraged more and more to use online services to handle things digitally, to avoid calling or coming in person, even though not everyone can easily do that. Not everyone has reliable internet. Not everyone is comfortable navigating websites. Not everyone has the computer literacy to create an online account and manage their benefits digitally. So when Social Security says this national system will help them manage work better, critics are asking a very reasonable question, which is this really modernization aimed at improving service, or is this a way to cope with having fewer staff to do the same amount of work? You see, even before these cuts, even when Social Security had more employees, the agency was struggling with backlogs. Disability claims could take many months, sometimes over a year from application to decision. SSI cases are inherently complex with multiple eligibility factors that have to be verified. And phone wait times for years were frustratingly long, with people reporting waits of 30, 40, even 60 minutes just to speak to someone. So some experts are saying, look, technology helps. Automation can handle routine tasks. Better systems can improve efficiency, but technology can't fully replace people, especially in a system as complex as Social Security, where human judgment is often required. Another thing to consider, and this is a concern I've heard from multiple advocates and people who work within the system, is local knowledge. Programs like SSI don't work exactly the same in every state. Some states have extra payments on top of the federal benefit. Some have different rules layered on top of federal rules, and eligibility can depend on details that are very specific to where you live. Things like how your state counts income, how they handle resources, what expenses they allow you to deduct. When cases are handled nationally by staff who might be unfamiliar with those state-specific variations, the concern is that staff may not be as familiar with those local nuances. They might not know to ask certain questions. They might not catch mistakes that a local employee would immediately recognize. And to be clear, this doesn't mean mistakes will definitely happen. Social Security is training employees on these new systems. They're creating reference materials. They're trying to maintain quality. But it does mean the margin for error could grow during the transition period, especially if training isn't thorough enough or if staff are stretched thin trying to handle more cases from more places with less local context. And speaking of training, that's another big piece here that deserves attention. Employees now have to learn new systems, new workflows, new software platforms, and handle cases from states they may never have worked with before. That takes time. That takes resources. And during that learning curve, service can feel uneven. Some people might notice faster responses if they happen to get assigned to an office with extra capacity. Others might feel like things are slower or less personalized than before if they get caught in the transition confusion. Some might find the experience more efficient. Others might feel like they're just a case number being shuffled around the country with no one person taking ownership of their issue. Now, the administration does point to some real improvements, and it's important to acknowledge those because it's not all negative. I don't want to paint a picture that Social Security is collapsing or that nothing is working. That wouldn't be accurate or fair. Over the past year, Social Security has reported answering significantly more calls than before. The numbers they've released show a substantial increase in call volume being handled. Average hold times on the main 800 number have dropped into the single digits for many callers, which is a big change compared to the 20-minute waits many people were used to, or the times when you'd be on hold for 45 minutes and then get disconnected. A large percentage of calls are now handled through self-service tools or automated callbacks. Though I'll be honest, I still hear from people who say those callbacks can take a while, sometimes hours or even until the next business day. But at least they're getting a callback instead of being told to just keep trying. Under current leadership, there's been a strong push toward using data, metrics, and technology to improve performance. This is a different approach than previous administrations took. There's more focus on measurable outcomes, on tracking processing times, on identifying bottlenecks and addressing them systematically. The Social Security website now runs around the clock with better uptime than it had a few years ago. Disability backlogs have come down compared to where they were in 2023 and 2024. Processing times for certain types of claims have shortened somewhat, which is good news for people waiting for decisions. And these improvements weren't just claimed by the agency. They were actually reviewed by independent inspectors who confirmed the data was accurate. So, yeah, there are signs of progress, and it's fair to say the agency isn't just standing still or letting things deteriorate without any response. But here's the tension, and this is what makes this situation complicated. Even with those improvements, Social Security serves about 75 million people. That's roughly 1 out of every 4 Americans receiving some kind of benefit. Retirement, disability, survivor benefits, SSI, that's a massive responsibility with very little room for error because people are depending on these benefits to survive. And when you combine fewer staff trying to serve those 75 million people, new systems that are still being rolled out, and a national workload model that's fundamentally different from how things worked before, the risk is that the transition period becomes bumpy for real people with real needs who can't afford disruptions. Now, let's talk about what this does not change, because this part is really important, and I want to be absolutely clear about it, so there's no confusion or unnecessary panic. Your Social Security check amount is not being cut because of this change. The March 7th changes are administrative and operational. They don't affect benefit calculations. Your payment date is not changing. If you get paid on the second Wednesday of the month, you'll still get paid on the second Wednesday of the month. Eligibility rules are not being rewritten on March 7th. The criteria for qualifying for Social Security retirement, disability, survivor's benefits, or SSI, those aren't changing. If you're already receiving benefits, those benefits continue exactly as before. What could change, at least temporarily during this transition period, is how easy it is to get help when something goes wrong, how long it takes to speak to someone, how smoothly issues get resolved, things like correcting an overpayment notice that was issued in error, fixing a Medicare enrollment issue tied to Social Security, resolving an SSI eligibility question when your circumstances change, following up on a disability claim that seems to be stalled, updating your direct deposit information, getting a replacement Medicare card, appealing a decision you disagree with. Those are the areas where people may notice differences in service quality or response times, at least until the new systems are fully running smoothly and staff are completely trained on the new workflows. I want to emphasize something here. This isn't about panic. This is about awareness. Knowing that the system is changing helps you be prepared and patient if things feel different for a while. It helps you understand that if you call and the experience is different than it used to be, that's probably because of these systemic changes, not because someone is personally trying to make things difficult for you. One practical tip I always share, and this matters even more during periods of transition like this, is to keep good records of all your interactions with Social Security. Save every letter they send you. Don't throw anything away, even if it seems routine. Write down who you spoke to and when. Get their name, get the date, get the time. Write down what they told you. If you submit documents, keep copies. Make photocopies of everything before you send it. Or better yet, if you can submit documents in person, ask for a receipt showing what you submitted and when. Take a picture of that receipt with your phone. These habits matter even more during periods of transition when systems are changing and cases might be moving between offices. Having a paper trail can be the difference between quickly resolving an issue and spending months trying to reconstruct what happened. Another helpful step is to use online accounts if you're comfortable doing so, because those systems are increasingly central to how Social Security operates. Creating a My Social Security account online gives you access to your benefit information, your payment history, and the ability to handle certain tasks without having to call or visit an office. At the same time, if you rely on in-person help, if you're not comfortable with computers or you don't have internet access, those offices are still there. Social Security has said clearly and repeatedly that field offices remain the front line. The shift is mostly about how work is assigned and processed behind the scenes, not about eliminating in-person service. Another thing to keep in mind is that this change is part of a broader trend in government. Right now, multiple federal agencies are experimenting with more centralized workflows and private sector style management approaches. The thinking is to run government more like a business. The IRS is going through similar changes, especially with refunds expected to be processed differently this year due to new tax provisions under recent legislation. The thinking across government is that technology plus smarter workflows can improve service without endlessly adding staff and expanding budgets. Just pausing for a moment to share something important with you. We've partnered with Chapter, a service we feel confident recommending for clear, honest Medicare help. They'll connect you with a licensed advisor who can compare every Medicare plan available in your area and help you figure out if you're paying too much or missing out on better coverage. Most people who call Chapter save around $1,100 a year. That's real money back in your pocket. It's completely free. There's no cost to you for their help, and their care advocate team is there to support you even after you're signed up, so you're not on your own trying to figure out claim issues or coverage questions. Call 615-639-1937 or visit askchapter.org/money using the link in the description below. Let's keep going. Supporters of these changes say this centralization and technology focus is the future of government. They argue that the old model was inefficient, with resources unevenly distributed and too much variation in how different offices operated. They say the new approach will reduce backlogs, speed up processing times, and provide more consistent service nationwide. Critics, however, say government isn't a corporation and can't be run exactly like one. They argue that mistakes in programs like Social Security have serious human consequences that go beyond a business losing a customer. When Social Security makes a mistake, someone might not get their disability payment, someone might lose their SSI benefits erroneously, someone might not be able to afford their medications or pay their rent. Both perspectives are worth considering, and this is where I think it really comes back to you and your experience. The success of this change won't be judged by internal memos or performance charts alone. It'll be judged by how people actually experience it in their daily lives. Do you get help when you need it? Are errors corrected promptly when they happen? Does the system feel more responsive to your needs or more distant and bureaucratic? Can you reach someone who understands your situation? Do you feel heard, or do you feel like you're being processed? March 7th isn't some dramatic flip of a switch where everything changes overnight for your benefits. It's more like the starting point of a long adjustment period. Think of it as a transition that will play out over months, maybe even a year or more. Some things may improve fairly quickly. You might find it easier to get appointments. You might notice shorter wait times on the phone. You might see faster processing of routine requests. Some things may take time to improve as staff learn the new systems and work out the kinks. You might experience some confusion in the early months. You might get transferred more than you used to. You might have to explain your situation multiple times to different people. And some frustrations may still exist even if the intent is to reduce them. Backlogs might persist in certain areas. Complex cases might still take a long time to resolve. Some people might still fall through the cracks. I'll be watching closely over the coming months, and what I encourage you to pay attention to is how your interactions with Social Security feel over the next few months. Not just whether you got what you needed, but how the process felt. If you notice smoother service, that's a good sign the new systems are working as intended. If you can get through on the phone more easily, if your appointments are scheduled more quickly, if your issues are resolved without having to call multiple times, that's evidence the changes are producing positive results. If you notice delays or confusion, that's important feedback too. If you're getting bounced between offices, if people seem uncertain about how to handle your case, if you're experiencing longer wait times than you used to, that's a sign the transition is bumpy and needs attention. And I'll keep talking about this as we see how it plays out in real life, because at the end of the day, Social Security isn't just a program run by bureaucrats in Washington. It's something people depend on month after month to survive. For many seniors, it's their only income. For people with disabilities, it's the difference between independence and destitution. Making sense of these changes together calmly and clearly, that's always the goal of this channel. I'm not here to tell you everything is great when it's not. I'm not here to panic you about changes that might actually help. I'm here to help you understand what's happening so you can navigate the system more effectively. One thing I want to be clear about is that the staff working at Social Security, the people answering phones, the people reviewing applications, the people helping at field offices are not your enemy. Most of them are trying their best to help people with very limited resources. They didn't design this new system. They didn't decide to eliminate 7,000 positions. They're trying to do their jobs under difficult circumstances. So if you do have to interact with Social Security in the coming months and you experience frustration, try to remember that the individual employee you're talking to is probably just as frustrated as you are. They're learning new systems. They're dealing with increased workloads. They're trying to help you while also managing dozens of other cases. Being patient and courteous doesn't mean you can't be firm about your needs. It doesn't mean you should accept poor service. But it does mean recognizing that the person helping you is a human being who probably wants to resolve your issue just as much as you want it resolved. Let me zoom out for a minute and talk about the bigger picture here, because these Social Security changes don't exist in isolation. They're happening at a time when there's a broader debate about the role of government, about how services should be delivered, about the balance between efficiency and accessibility. Some people believe government should run more like a business, lean, efficient, focused on metrics and outcomes. They see centralization and technology as tools to eliminate waste and improve performance. They think the old way of doing things was too slow, too inconsistent, too resistant to change. Other people believe government has fundamentally different obligations than a business. They argue that accessibility matters more than efficiency. They think local knowledge and personal service are valuable even if they're less efficient. They worry that treating citizens like customers misses something important about what government is supposed to do. Both worldviews have merit. Both raise legitimate concerns, and the truth is probably somewhere in the middle. We need government to be efficient enough that it can serve people well, but we also need it to be accessible enough that everyone can get help when they need it, not just people who are comfortable with technology or who have the persistence to navigate complex systems. What makes this particularly challenging for Social Security is the demographics of who it serves. The average Social Security beneficiary is in their 70s. Many are dealing with health issues, cognitive decline, or physical limitations that make it harder to adapt to new systems. Many grew up in an era before computers and the internet were everywhere. Asking a 78-year-old who's never used a computer to suddenly start managing their benefits online is a big ask. Telling them they should just use the website instead of calling or visiting an office ignores the reality of their circumstances. At the same time, Social Security can't keep operating with paper-based systems forever. Technology can improve service if it's implemented thoughtfully. The question is whether the transition is being done in a way that brings everyone along or whether it's leaving some people behind. Looking ahead to the rest of 2026 and beyond, I think we're going to see more changes at Social Security, not fewer. The March 7th implementation is just one step in a larger transformation of how the agency operates. There's talk of further automation of routine tasks. There's discussion of expanding online services even more. There's planning around how to handle the retirement of the baby boomer generation, which is putting enormous strain on the system, both in terms of workload and in terms of the trust fund's finances. All of this is happening against the backdrop of ongoing political debates about Social Security's future. Should benefits be expanded? Should the retirement age be raised? Should means testing be introduced? How should the program be funded long term? Those are big questions that go beyond what we're talking about today, but they're part of the context in which these operational changes are happening. Social Security is being reshaped in multiple ways at once, and it's important to pay attention to all of it. For you as a beneficiary or potential future beneficiary, the key is to stay informed. Don't assume things will work the way they used to. Don't assume the information you got 5 years ago is still accurate. Systems are changing and you need to change with them. But also, don't assume you're alone in navigating this. There are advocates, there are resources, there are people who understand the system and can help you. If you're struggling to get help from Social Security, don't give up. Reach out to your congressional representative's office. They have staff who help constituents with Social Security issues. Contact legal aid organizations that specialize in benefits issues. Find advocacy groups that serve seniors or people with disabilities. You have more power than you might think to push back when things aren't working, to demand the service you deserve, and to hold the system accountable. So to wrap this up, March 7th marks a significant change in how Social Security operates internally. The move to a national workload system and centralized scheduling could bring improvements in efficiency and backlog reduction. It could also create temporary disruptions and confusion as the system adjusts. Your benefits aren't changing. Your payment amounts aren't being cut. Your eligibility isn't being revoked. What's changing is the behind-the-scenes infrastructure of how cases are processed and how help is delivered. Stay informed, keep good records, be patient during the transition, but don't accept poor service. Use online tools if you can, but know that in-person service still exists if you need it. And keep watching this space because I'll continue covering how these changes play out, what's working, what's not, and what you need to know to protect your benefits and get the help you deserve. Because at the end of the day, Social Security isn't just a program. It's something people depend on month after month. And making sense of these changes together calmly and clearly, that's always the goal. Thanks for watching. Let me know in the comments about your experiences with Social Security, and I'll see you in the next one.